Good evening. Welcome to another episode of our month-long e-conclave on breast cancer, brought to you by the IHW Council and Novartis India. I'm Anisha Nair Dhawan, your host for the show. While breast cancer patients can improve with treatment, the psychological effect of the disease can last longer, accentuated by social stigma and inherent gender bias. Today, the experts who will join us will speak about how to support breast cancer patients emotionally during the treatment and recovery. But before we start the discussion and welcome our esteemed panelists, here's a snapshot of the ground that we've covered in the Breast Cancer Action Month, addressing India's breast cancer epidemic, moving from awareness to action. We kick-started our month-long campaign on 1st of October. Here's a quick recap of the ground that we've covered.
Breast cancer is the number one type of cancer in women today. To exhort and encourage all of us to move from awareness to action, ISW Council, in partnership with Novartis India, embark on month-long mega virtual conclave, Breast Cancer Action Month.
Awareness around cancer, awareness around women health, awareness about around all the artificial things that we engage in, and vanity has its own impact on our health, and I think it's time to turn the tables on the other side.
The problem is really at two levels. One is, like I said, with the media centering a lot of communication around what is significant in that month. And the second is, as a society itself, we just don't want to mention the word breast.
Why do you think that people in US, they are diagnosed stage 0? 80% of the ladies, the disease is diagnosed in stage 0, 1 and 2. While in India, it is 80% stage 3 and 4. Why? Only one reason, the awareness.
At the moment, the issue is that three factors. A, do not recognize when it happens to them. B, when they recognize, they take so much time to report that it becomes late stage. And C, that what kind of treatment are available and they receive finally.
You know, the single biggest risk factor for all cancers, including breast cancer, is aging. If you live longer, then you are more predisposed to get all kinds of non-communicable diseases, including cancers, including breast cancer.
It is very natural to panic when somebody very close to you, undergoes cancer. And I think for that reason, it is very important to know your right sources of information.
So there were three things which I think you should not have a fear. You should have an early consultation, and you should not consider any other pathy. You should go for only evidence-based medicine.
And I think COVID has shown us that we can learn a lot, and we can learn it fast if we have to. And I think my call to action would be, let's take this learning and apply it to cancer, move fast with inclusiveness, move fast with inclusiveness of the stakeholders who are involved.
Many patients may not require chemotherapy, many patients may not require radiotherapy. But every patient, some or the other time, they require palliative therapy. So palliative therapy is a very, very important.
As the disease advances, patient needs palliative care right at doorstep. That time, palliative care can be given by the trained staff, nurse, or a volunteer, or a social worker.
Thank you so much for joining us today. To fight against breast cancer, we need awareness and action at all levels. And to make every woman and man become the ambassador of good breast health, the IHW Council has begun a mass movement of taking a pledge that each one of us will talk about breast health with at least 5 people in our lives. the lawmakers, social leaders, influencers, and medical experts who have been joining us to chart out the way forward to prevent breast cancer in India have also shown their exceptional support to this campaign. We are thankful to Novartis India for its support to this movement. We would request all our panelists and all viewers watching today to sign this pledge by clicking on the link in the comment box of this live post. You can also sign this pledge by visiting our website, which is the ishwcouncil.org website. When you sign, you'll receive a certificate with the name on it. Do share this certificate on your social media handles and tag 5 people to take this pledge and promote breast health in our country. So I would request all of you to please strengthen this movement and make India breast cancer free. Now, let's come back to the topic we're going to talk about today. Most women experience at least some psychological distress during the course of their breast cancer diagnosis and treatment. Cancer related distress can be expected to dissipate with time for the majority of those who have been diagnosed with cancer. For others, however, such distress may interfere substantially with their comfort, their quality of life, and their ability to make appropriate treatment decisions and adhere to treatment. Should the oncology team treating the patient be cognizant of her mental health? What support groups exist to help breast cancer patients overcome the stress of having the disease and fighting the disease? To talk about all of this, we have an esteemed panel of experts today. Please welcome Dr. A.K. Malhotra, Senior Surgeon and Head of Department, South Eastern Railway Hospital, Kolkata. We also have with us Dr. Krishna Prasad, Chief Medical Oncologist, Mangalore Institute of Oncology. We have Prakati Prodar, Global Head of Mental Health at Round Glass, and we have Robert Palmer, Head of Value and Access Oncology, Asia Pacific, Middle East, Africa, Novartis. And we also have with us Preeti, a breast cancer survivor, to talk to us about this important issue of the psychological impact of being diagnosed with breast cancer. A warm welcome to all of you. Dr. Malhotra, let me start with you. What are the usual psychological needs of a breast cancer patient? You know, just the word cancer instills some amount of fear in most people because, you know, of the deadly nature of this disease, which, you know, is largely historical. You know, things moving ahead may be much better, but historically, people have been afraid of getting cancer. And, you know, with breast cancer, there's so many issues that come up. What will society say? What will my neighbors say? What will my family say? I'm going to be disfigured. There's so many issues that come up. So what are the psychological needs and how can you tell that the patient needs support?
So I think at the outset, I would think that the phrase some amount of fear is an understatement. I think there is a significant amount of fear, huge amount of fear associated with this diagnosis. Whenever the patient hears of it for the first time. And yes, I mean, I think, you know, as an immediate reaction, of course, it's one of shock and disbelief, and more of shock, in fact. Then, of course, I think as things settle down, you have a variety of emotions which, rise to the surface. Young women who have their children to worry about, and I think that's one of the most important things. Those who have small children, they are the ones who are most concerned about what happens to my children if something happens to me. And obviously, if something happens to me, becomes the most worrisome feature. The other aspects, of course, are when, you know, it's about any of their relatives or their friends having had breast cancer, you know, so about the hair loss and if they've, you know, the kind of sufferings that they may have had with metastatic disease, the pain that they go through. Then, of course, there is another issue about whether their next of kin, their daughters, could inherit breast cancer. So that is another source of major concern. So, you know, initially, of course, it's a kind of, it hits you like a hammer on the head. It's a complete sense of shock. And I think it is very, very important for them. Maybe you'll discuss later about getting in touch with survivors which give them a lot of confidence, even more so than what the doctor would do.
Prakriti, want to come to you. Worldwide, it is known that illness is usually a reason for depression. It gets people down, and illness as major as cancer can be very concerning for patients. In breast cancer, usually diagnosed in women, uh, they have their own social, emotional health issues to have to deal with. Sometimes even financial reasons may bog them down. What have you seen when do you think the psychological impact of having breast cancer is fairly overwhelming for women?
Yeah. Thank you, Anisha, for having me here, and I'm really excited that we're actually talking about this. In my clinic in Bombay, we have had a lot of patients that are dealing with sort of the mental health challenges that have come out of having, sustainable diseases, chronic illnesses, and it's not only for them that we're actually sort of taking them through the sessions, but also their family members, because a lot of people don't recognize that it's not any disease doesn't impact only the person who has the diagnosis or the prognosis. It impacts the entire family, and people don't know how to deal with this in a fashion that will be conducive to the well-being, mental well-being of the patient. So it's extremely important, and I find that in India, I mean, like you said in your video as well, people don't even understand how to talk about breasts. There is no training. I mean, I grew up for my entire youth was spent in Canada. I mean, I'm here right now as well. And one of the things that we are taught in school as well is how to do a breast examination. And it's commonplace for girls to start doing this as soon as they start to mature. But this is not commonplace. In India, nobody really talks about it. So that is why actually you receive any input on this when it really actually is almost at a higher level, maybe stage 3 or 4. It just becomes bad, and then you kind of like approach it. But the mental health impact, I mean, just starting from your discomfort, as the good doctor there mentioned, it goes into disbelief, shock, then guilt. Sometimes moves into sort of mood disorders over a long period. Also, the therapy itself holds a lot of actually brings about a lot of hopelessness, and there's changes in the body that take place. And I have to say, there was only one lady who had come to me for therapy, and she just had a surgery, and her spirit was really, really good. Her healing was she actually believed in the power of her healing, and the fact that it wasn't doomed for her. And I remember that she healed faster because of her belief system, which is, I'm going to fight this, I'm going to get better. But there was another one who really was already well, but was grieving her hair loss. I mean, it was the worst part for her, that was the worst part. So what I'm trying to highlight is our perception of what's happening with what we're going through really dictates how we work through the illnesses that we have, and how we connect not only our mental well-being, but also our recovery to our thought process. Of course, there are support groups out there, and I think one of the most important things is to join support groups, because you will have people who've been through the journey and are speaking from that place, rather than people who haven't been through it, such as doctors or even counselors, who would be talking about it from a point of view which is once removed. But you are talking about it with people who have been there, will really help you to move past your feelings of anxiety, your feelings of anger, your feelings of loss, and move you away. The other psychological problem is that women across the board, just through the narrative that women have, the breast is such an important part of their beauty and what people consider as feminine. And once that's removed, I mean, their feeling of femininity almost starts to dwindle. And again, that becomes a point of view that we want to change, especially in this conversation, because you are still a woman. Your body is a vehicle. And yes, we have to fix that vehicle. We have to help train that. We have to cope. We have to ensure it's in optimum operation. But you are beyond that. And just to get people to kind of individualize themselves based on their exterior is not something that is healthy. And teaching them how to build back their comfort with their own body also takes a lot of hard work as we start to sort of work through gathering yourself past the illness.
Right. So support could, of course, play an important role here. But Dr. Malhotra, I'll come back to you. Are the teams that are treating the patient, the oncology teams, really mindful about their mental state as well? Because, uh, and does it, the kind of counseling you give to the patient and the stage at which they are presenting with the disease, does it impact how they feel that they will recover from the disease and hence the stress that they undergo?
Yeah, so obviously, if a patient presents with early disease and we are able to assure them that the results are likely to be good and that they should make a good recovery and long-term survival, that does have an important impact. If they would present in stage 4, for example, and we are obviously not going to, be able to convince them that they will do well. So that, we would try and put it in the best way possible, but then obviously the stage of the disease does make a lot of difference as far as counseling is concerned. Now, as regards whether our teams are adequately counseling our patients, well, yes and no, because my team would counsel them to the to a significant extent possible, but could more be done? Yes, I think so, because when we are working in busy clinics with long queues of patients and a large number of patients in the hospitals, maybe we do not, even if we wanted to, spend enough time, or the amount of time that needs to be spent with patients who are having a number of worries, hair loss, disfigurement, sexual function, children, etc. So yes, we do try to explain things to them to the best extent possible, but I still feel that doctors and oncology teams possibly are not fully equipped to deal with the situation as it evolves. And generally we would be doing this in the initial stage, but repeated sessions, well, I don't think that is very commonly practiced. And maybe the role of counselors is also very important in this regard.
Dr. Prasad, how important is, how you explain the prognosis to the patient, how you explain what the disease is? Does more like transparency and proper information lead to less stress for a patient undergoing diagnosis and treatment of breast cancer?
Yeah, I think it's a very important question which you have raised here, because the immediate reaction of most of the relatives is don't tell the details to the patient because they will not be able to handle it. The truth is generally patients are able to grasp it, and a good explanation about the type of disease they have and what treatment they need to undergo and what are the complications which they should expect goes a long way actually in enabling them to fight this disease. So I think that's a very important question, and I think the relatives especially need to know that the patient is the best person to take decisions and probably needs to be explained in great detail. Sometimes in stage 4 cancer that becomes little bit tricky. However, even in that situation, I think the patient would be better off if they had some idea what is happening inside. I think sir also would agree, we do see quite a few patients who do not have the entire grasp over what exactly they have. And they find it very difficult to deal with the complications, and their compliance also seems to go down compared to someone who has understood the disease and understands the consequences of their action in taking the treatment as per schedule.
All right. Robert, Prakriti told us, gave us an example of a patient who was positive, and she believed that she would beat this, and she got by well. So, is there any science to this that drugs work better if you believe in them?
It's a very interesting question. I mean, there's this. One very important factor, and it's already been touched on, is compliance. So drugs don't work if you don't take them, and so for a patient to take the medicine, they often really have to believe that it's going to help them. If they don't believe it's going to help them, or even worse, if they're actually worried about the side effects and don't know how to manage the side effects, then they could miss doses, or even worse, stop taking the medication altogether. So you've really, and the whole ecosystem around the patient has a role to help them understand their disease, understand the therapy that they're taking, and then help them through it, help them manage the whatever side effects that they're facing. So yes, I think there's a critical role, not just for the medicine, but for the mind and the spirit as well.
All right. We have with us a breast cancer survivor. Preeti is also with us, and we want to understand from Preeti how she felt when she was diagnosed with breast cancer, and what were the thoughts and the emotions that came to her mind when she discovered she had breast cancer, and when the doctor spoke to her about her diagnosis. Preeti, if you can hear me, we want to understand from the patient's point of view, what did you feel when you were told that you have breast cancer? Was it disbelief? Was it denial? Was it, a sense of dread? How did you feel?
Yeah, good evening, everybody here. Uh, Firstly, when I was getting diagnosed, there were tests done, and generally I just started losing weight, and there was nothing to explain it. So I just gone to my family doctor, and we were trying to run all the tests. Tests getting done, he had written the C9 test, and somewhere or the other, I could make out that is a kind of cancer test. So, but luckily, in that test also, there was nothing it showed a negative result. So what happened is all the more it was getting into, okay, you had colitis earlier, very old times. So maybe that has led to some kind of different this thing. So let's do all the investigations. And then an initial level of tests done, I was like, just forget it. There's nothing, because thyroid was also normal, and this was also normal, and most of the tests were coming in normal. I said, I don't think there is anything too much. Maybe, okay, it could be some colon kind of infection or something of that sort. So just let's give a chill pill and nothing. It shouldn't be anything else. But unluckily, what happened is after, I started, my stomach problems were getting more and more. And then we had done this colonoscopy from below, and that showed it had some kind of, tumor kind of thing in it, like the lower levels. Because my breast cancer it had traveled to the bones, and the whole of my spine and everywhere, I had nodules, tumors, yeah. So it was all over my spine and my ribs and everywhere. So actually the discomfort was quite a lot. And earlier I used to complain, but then I had fibromyalgia. So it was mistaken as per that. So then it was definitely very shocking when it came to that, maybe it is something so severe. And the moment the word of cancer comes, it's just like, no, I don't think I can have cancer. It's impossible. I cannot have something so dreadful. That was the way it went. But luckily for me, I didn't have too much of time given to breathe. Like it was immediately in one day I was taking for a CT scan and MRIs and everything, everything was going side by side, the biopsy and all.
So when the doctor spoke to you, Preeti, did you understand your condition properly? Did you understand how long your treatment will be and what could be the possible outcomes?
No, I was absolutely not aware of anything else. Like it was just something grave. The situation is quite grave, but I was not aware of anything. Even when I came to know after the CT scan, it's cancer, but I did not know the stage and things like that. So kind of, I think I got a time where maybe because I did not know the graveness of the situation, the stress level was much more controlled.
Okay.
If I would have known that it's fourth stage cancer, I think I would have been under so much stress that anything would have been much more difficult for me to take that and handle that situation maybe. Okay. So at that time when my family supported me, they did not let me know it was fourth stage cancer. Somewhere I got a little breathing time kind of thing, And I think in a way that was better in the initial stage. Unless I think after 15-20 days, I figured out when doctor once it just slipped off, like he said it's fourth stage. And then I was a little under shock. You all didn't tell me it's already that stage kind of thing. But fine, I think the family was also very, very supportive for me. So I was lucky in that manner. Plus my doctors also, my doctor gave me extreme this thing. He's like, okay, no problem, we can handle this. That
okay, she was positive.
Yeah, he was very positive. So
what did you feel, Preeti? What did you feel? Did you feel as positive? Did you think that you will beat this and come out on tops? Did you feel afraid any time that this isn't going to work for you? Were you worried about what impact the treatment would have on you, whether you would lose your hair or you'd have to undergo surgery, or did you have any of such thoughts?
Yeah, the main concern for me at that time is I don't really know how long I would be alive. That was the only main question for me. Because once when you come to know it's that stage of cancer and I know all my bones are affected by it, it was very this thing, okay, I really don't know how much time I have in hand. Rest of the things didn't worry me at all because, that was the only posing question for me at that time. But the moment when the first 3 months came by, the first reports, the first tests were done again, the CT scan, it showed a lot of positive result. It showed recovery everywhere and the activity had nearly stopped at that point. Okay. So that gave me a lot of reassurance as to how it would be kind of.
Preeti, did you said that your family was very, very supportive, but did at any point of time you think about, what society would say, what your neighbors would say, or your friends would say that you have breast cancer? Did that ever cross your mind?
No, absolutely not. As I said, the situation at that moment, it only felt more important. Okay, am I going to survive through this? I didn't feel anything else at that time. And yeah, so, and the rest of the family just supported me and made the whole atmosphere feel very lively. I'm in a joint family actually.
Okay.
So I have 4 sisters at home, and plus my husband's family, it's a huge family. So the 4 sisters' daughters came in, and my sister-in-laws came in to just make the whole atmosphere seem very, very lively. Okay. So I didn't have that much time to think so much about other things in that manner. So luckily, I was very lucky at that stage. Yeah.
Right. So Preeti, you said that after the 3-month CT scan report, there were positive outcomes. So after that, were you more hopeful? Were you, happier, and did you feel less stressful about, going through the course of treatment?
Yeah, actually, for me, the treatment
Preeti, you had a very supportive family, but did you ever reach out to the doctor if you had any emotional concerns, if you were feeling depressed, if you were feeling that if you were feeling low? Did you ever approach your doctor or any support groups?
No, absolutely nothing. Because as I said, I didn't have even one spark of time where I felt low. Truly saying, I felt I have got the gift of life. So that's like, something beautiful that I have to nurture most. I have to make most of it as to how much ever life I have. That is what was the approach for me. So I was just making most of each and every day that I could get. I believe a lot in Jainism, and that makes you feel, I wanted to reach somewhere where I could make most use of my life that I've got. So it was like a golden opportunity that I was seeing. Okay, I see that there is an end to come, but whatever the time that I've got, it's not suddenly come to an end as like a heart attack or as an accident. Those people just end their lives in minutes. And I have got a beautiful chance to live and do whatever I need to, whatever I can, to make the most of it.
Right. Stay with us, Preeti. We'll come back to you. But I wanted to, come to Prakriti. Prakriti, we're seeing Preeti's example. She had a very supportive family, and she herself, believed in her situation. She had the gratitude for the life that she had. And, nobody, her support structure was such that they didn't let her feel down. They kept a lively atmosphere. Her treatment went across as planned. She started feeling better. So, for, it, this is her case. For many other patients, this may not be the case.
This is
So,
a genuine case. So general, it's like if you have something to fall back on, and this is what I keep telling my kids as well, who are completely, well, he calls it, one of my youngest one calls it, I'm completely autistic. And I said, you don't mean autistic, you mean an atheist. And he said, yeah, no, that's the word, right? But religion, faith, and things that give you hope really have a very strong mental resilience sort of token. So when you have that, you have something that you can fall back. There's a purpose in your life, and I remember that I was reading Viktor Frankl's book, and I love where he said if you know the why. You'll do it anyhow. Like it's a quote for him, and it's all about purposeful living. So Preeti, of course, found that purposeful living moment, and she realized that that's how she wants to live her life. And we're all actually unaware of our own. I mean, we're only transient beings, right? And we're unaware of this until something comes and hits us in the face. And when it hits you in the face, you either have fight, flight, freeze, or fold. And Preeti is a fighter, so we saw that she went from 0 to 100 in like, oh no, I have something to do, and I am going to make sure that I live my life in purpose and with cause, and fight this illness. And that's what she did, and therefore you see the way in which she turned out. And of course, this is not like a platform where we're talking about mental resilience, but it helps in every disease. I mean, you're talking about disease, people with any NCDs, chronic diseases, unless they want to fix themselves. Again, this is not about, and I think I want to verify that most people think that disease is a fault of theirs, right? So it isn't a fault at all. These are things that happen, and when they happen, if you blame yourself or you blame circumstances around you, opportunities of well-being don't arise because you're in blame, and blame, as you know, ends with me. And so unless you are the BLAME, so unless you're aware of that, you can't actually build your reservoir of resilient strategies to be able to cope holistically with the situation that you're in. So I love Preeti's approach, and that's another reason why I think people need to have something to fall back on, right? You need a support system, whether it's people, whether it's your religious and religion sort of groups or manifestos, whether it is your friends and or support groups which are built out. So it depends on what you have access to, but you have to have access to something that's nutritious for your well-being. And that's what really would make you not survive, but thrive. And one of the things I remember, there's a gentleman called Dr. Nimesh Desai, who next time you must bring on, and I think you've had him on before, and he is the head of the EBAS, and he said he has a real fight with WHO on what well-being means. And he said, it's not about like, well-being is not just because you have no disease, but it's living well despite having a disease. And I think that really should be inculcated in the concept of well-being, which it doesn't. And I really am going to advocate what he says and quote him, of course, because I don't like plagiarism, but really get him to, get this idea out there that you can live well despite the disease, and let's work on that mental resilience and your mental capability, and find you ways in which you can build that support for yourself and around in your ecosystem. And I think the more you are, and this is another thing, just with mental health, your environment is sending you information all the time. So the kind of people that you have around you, if the noise is beneficial, keep it. If it's not beneficial, get rid of it. And you have control over that. So if somebody is negative for your well-being,
stay away from them.
Keep them out of your frame of reference. You don't need it.
Right. Dr. Prasad, we've seen Preeti's example. She had a very supportive family. Now, sometimes, her treatment also showed positive results, but sometimes patients may have a lot of pain. They may have a lot of side effects, and that gets them down. And no matter how much their family support them or help them, they still feel guilty of being, perhaps a burden on them, be it their time or their financial sources. So, have you ever seen or seen instances where patients have, told you that I can't do this anymore because I feel that this isn't going to work? It was basically the emotional state that, prevented them from keeping the course with the treatment.
Yeah, I think we do see a lot of such patients, especially like how you said, when the treatment fails, or when the patients are on very expensive medications, after a few cycles, when they know that they are not doing well, they tend to feel really low. And we try to help them emotionally. We have support people, counselors who do their job, but ultimately, each individual has to deal with the situation on their own. They can get whatever support we can offer, but still they need to accept the situation and deal with it. And each person has their own way of managing that situation, and that in some ways related to who is around them. So I have seen some amazing people, support their family and friends. People who have left their job in US and resigned and come back to look after their elderly mother. And once the mother has passed away, they try to do something here rather than, hang on to their lucrative jobs in the US. And we do see some amazing people. Like at present, I have a patient with multiple myeloma whose two sons have left their job and come and looking after their father in an amazing way. So I think, yes, that is the major thing which is important. But like how you said, patients will go through these cycles where they feel that they are a burden and they don't want to be. I've seen this very commonly among elderly people when they see that their children have left their jobs and spending a lot of time and money on them, that they feel that they are a burden on them. At that point of time, I think we need to make them understand that when the children were very young, they looked after them and they never thought of them as a burden. So I don't think the children think like that. And sometimes when the patients do think like that, it also makes the children sad or the caregiver sad. So we need to just reinforce that. And many a time, it's just the patient requires time to understand the situation, and eventually they do accept and come over it.
Right. Dr. Malhotra, how important is counseling of the family members as well? Now, we heard Preeti, and she said that, her family protected her from knowing the stage of the disease. Perhaps they thought that it was better for her. And, 3 months later, she felt better. Things started to improve. Now, she had amazing family support. They handled her in a way that seemed to work. What is the best way to prepare family members as well? Because it's a big shock for them. and they have their own advice and do this, don't do that. It may not be scientific, it may not be recommended by the doctor, but they have something that they think works best. So how do you counsel the family members to be supportive and also to respect the wishes of the patient?
Yeah, I think it's very important because Preeti, of course, as I told you, had an exceptionally supportive family. Now, a lot of patients do have very supportive families, and some of them less so. And I think we see, we see the entire spectrum. I think it's important for us to counsel the families as to the fact that they need to be with their patient because she is going to go through a lot, and they need to constantly, keep buttressing her confidence. And at the same time, this is sometimes a little difficult, as Krishna Prasad also just said, that many of our as part of Indian tradition, let me put it, they would not like their patients to know exactly as to what they are suffering from. Sometimes they would not even like them to know that they have cancer, which in a way is, in my opinion, not very right, because I have seen finally the patients who do know what they are suffering from, at least they are suffering from cancer, they deal with it. There is an initial period of shock, true, and disbelief and denial, and why did it happen to me? But finally, I think they come to terms with, whatever has happened, and they deal with it very much more differently. For example, I recall a patient, of course, this was a case of gallbladder cancer, and she came to me, she was advanced, she was too advanced for surgery, and I told the husband initially that, well, that there's nothing much that we could do beyond palliation. They took a couple of other opinions, and they found that, well, the opinions did tally. And finally, when the patient, passed away, the husband came back to me and said, doctor, the last 1 year has been the best time of our lives. I have only spent my time, extremely busy with my work, and we were kind of, we were just kind of busy doing all kinds of mundane jobs, trying to run the wheels of the family, etc. But once we came to know that, well, we had some time, as Preeti very rightly mentioned, that, they have time to do something good. We discussed all that we wanted to discuss. She told me as to exactly what she wanted her children to become, what kind of a marriage they should be having, etc., etc. So he said that during the last 1 year, when we were actually, both of us were aware of what was happening and what would happen, I think we have spent the most frank and free, we've had the most frank discussions amongst ourselves that we never had for the last 30 years of our married life. So, yes, I think it varies from patient to patient, varies from family to family. But I think, yes, families need to be told to be supportive. We also need to tell them exactly about the benefits of treatment, the costs of treatment, because, sometimes they may go through a lot of financial stress with actually not much to gain. So the exact, cost benefit must be explained in a manner that is empathetic, but also realistic. And yes, I think different families react differently. I think the vast majority of families I found are supportive. But sometimes, of course, but we always need to counsel them about the needs of the patient. Yes.
Right. Robert, we've seen that, Preeti mentioned that she was ER positive. So she had hormone treatment and it helped her. I want to understand from you that do modern medicines give patients hope that they will have better outcomes? Is this realistic? Is this make-believe? What would you like to say? Because, what we have understood over the course of so many days of having this this program is that, early detection is very important. If you come in early stages, the outcomes can be very good. We've seen patients who had their cancer diagnosed 30 years ago, still alive, kicking, enjoying life. So, early detection is very important. But just the belief that, oh, today, these days, medicine is very advanced, I'll get saved. Is that false hope? Or how should people look at the role medicine and therapies will play in the treatment?
Yes, and I want to reiterate that point around early diagnosis. All the medicines in the world are not worth the same as early diagnosis. If you can catch it early, that does more than any therapy that we will ever come up with. So I want to stress that. But the state of cancer research is that we're probably going through the best time ever in terms of discovering new therapies which can extend the life of patients. And what we're moving into a time now from that pretty much everyone would be given to targeted therapies. So this is where you take part of the tumor, you test it, work out what's driving the cancer in terms of its biology. And then the patient can take a therapy which is very specific to them. And what this means is that sometimes you can get a much better effect with fewer side effects. Now, it's still not perfect, but with the combination of earlier diagnosis, a more complete package of care, and these new therapies, we're making huge progress. But I guess that in terms of the psychosocial side, we shouldn't just see the medicine as a standalone therapy. It has to be seen in the context of the full care. And so as the patient goes through their own journey, hopefully from diagnosis to treatment to recovery to returning to a full life, sometimes unfortunately we don't catch it soon enough. There are so many interventions which can help the patient deal with their cancer. And we can really split those down and study those in the same way as we can study therapies. And they have amazing effects on people's quality of life, as demonstrated in clinical trials. So, whether it's understanding your own disease, whether it's understanding the medications you're taking, whether it's talking about the impact on relationships and family, whether it's financial counseling to help families deal with the financial burden of therapy, or even the after effects of a change in losing job, or unfortunately bereavement. All of those things have a really important impact on quality of life, and even simple things. And in a country like India, where you have wide disparities of wealth, we also need to consider interventions which which can be as good as anywhere in the world in terms of the cost. But we also have to think about interventions which are available to everybody. And I think with new technology, new digital technology, there will be interventions which are accessible to everybody.
That sounds very hopeful, Robert, especially for people in India. Prakriti, I want to ask you, what do you think is the role played by support groups? Now, you spoke about growing up in Canada and what kind of awareness exists in Canada. Now, in India, women don't, they even if they see something, if they feel something in their breast, they ignore it. They feel, why create trouble for everybody at home? Why should I be a burden or a headache? And, this is there on the back of the mind. While they have family, some may be very supportive, some, are not that demonstrative. And the women tend to feel guilty because of their place in the society, because of the social strata in our country. How important are support groups to a woman who feels that she is of least importance in her family? Do you think she has the courage to reach out to other cancer survivors in our, say, tier 2, tier 3 places? Could support systems work in such a situation?
It's a very interesting question, but it really does highlight the gap that we have in the way in which women are treated in society, and especially in this patriarchal society. No matter how many conversations we get on about how things are equalizing, it really isn't. And women are geared towards not spending too much money on themselves, and they will, you know, spend money on their family, the education, etc. And if this becomes something that they haven't prepared for, plus, you know, insurance. I don't know if you have any insurance people here, but our insurance just gives a payout, right? I don't know if I'm sure you're aware of that since you've been doing this conversation for about a week. It doesn't really cover the cost of medicines that are, you know, high quality. Okay, so obviously they're not going to get the kind of support that they need if we're talking about. So we're talking about tier 2, tier 3 regions. We're not talking about tier 1. And anyway, I like conversations to be around India as a population rather than just the elite. And there are high chances of this not being a conversation in the villages. I know I do a lot of work through the foundation with not only villages but like communities which are underprivileged in a way. And this is not even this. Forget about the awareness. This is not even I mean, there is no awareness, first off, right, of any disease, let alone this. It's always about, okay, I'm aging. They're okay with aging. You know, India's okay with aging, right? We know this. They're okay with aging. They don't really consider these things as to work towards. It's a mindset. It's not something that they would look at. They would just say, okay, I'm aging and this is what happens with age. And that's all, right? So we know that at 30, actually, you have to start like testing yourself. Actually, they say after every period or during every period, link that up to your testing so that you're self-testing. But how many doctors would you go to and how many doctors, GPs I'm talking about, would actually guide you to the self-testing? Because there's also such a lot of I mean, there is a divide between the conversations that even a male doctor has with his female.
Prakriti, this we have discussed at length, but you know what I want to understand is, do you think women who feel that their place in their family is lower are in any place to reach out to other women who may feel the same way?
Well, women who feel like they are lesser than anybody else will never will never think that they're at par to help anybody else, because they don't have that kind of self-empowerment. So no, that's not possible. But the support groups are run by people who feel that they can help other people, because do that. So you obviously have so those are not the women that feel disempowered. So if you feel empowered, it doesn't matter what community you're in. It really depends on your family structure. If you feel empowered in your family structure, depending on, it doesn't matter what tier you're in, you will be the kind of person who will speak. But this is not just related to cancer or, you know, to anybody dealing with an illness. It's related to anybody who feels empowered or feels disempowered.
Dr. Malhotra, do doctors come in and suggest support groups? Sometimes does this happen if a patient feels that I don't want to burden my family with not just the treatment but my emotions and my feelings as well? Can doctors or drug companies connect them with patients, other patients who may give them hope, who may talk to them about their own journeys? Do you provide that bridge to patients taking breast cancer treatment? Dr. Malhotra, I request you to please unmute yourself. We can't hear you.
Yeah, so I think support groups are extremely important, because firstly, support groups are generally, I mean, either headed by or at least composed, you know, in the real, I would say, of breast cancer survivors. And in my experience, I think, you know, showing a survivor to a patient gives her a great sense of hope. It was only, I think, 3 days back, there was this lady who walked into my clinic, and the moment she was told of her true-cut biopsy report, she went into a state of shock. She started weeping. And the nurse in my clinic is actually a breast cancer survivor. She had been operated about 26 years ago. So, and she had a 3-year-old child. This lady had a 10-year-old child. So I immediately asked the nurse to come in and just tell her that she said that I have a 10-year-old son. And the nurse told her, well, you know, when I got my breast cancer, I had a 2.5-year-old son. And I went through the same feelings, maybe even stronger such feelings, even stronger feelings. And I think when, after their conversation for about 10 minutes, though she's not part of any formal support group, but obviously, she's in the clinic.
Mm.
Comfort to the patient. So I think support groups particularly are important, more so because many of them are actually headed by breast cancer survivors. And in my opinion, I think nothing gives them more comfort. Yes, as far as the medical part is concerned, it is the doctor's word, but I think they would still believe or get much more or imbibe much more hope from somebody who has survived for 25 years rather than a medical person giving some kind of an objective discourse on her condition. So I think
right.
they form a very important part of this.
Dr. Prashant, how do patients reach out to support groups? I wanted to understand that. Robert said that technology is improving, and because of this, we expect earlier diagnosis. Algos will get us a better, disease management techniques and ideas. And we are seeing in this COVID world, we are, socially distant, but we are connected. So how do people find cancer support groups, breast cancer support groups, and do doctors also play a role here?
Yeah, see, I would just like to answer this in a different way because I am practicing in a tier 2 or a tier 3 city, you can call it. It's a small place, Mangalore. So, population is hardly anything in Mangalore. So to get a support group here, to have people, it's not that easy as in say Delhi or Mumbai or Bangalore. So what we have done is we do two important things. So for example, if there is a long-term survivor who comes to our clinic today for regular follow-up, we request them to just speak to some of the patients who have been started recently on treatment. In that way, the persons who have been started on treatment get a feedback from somebody who has taken treatment, say 5 years back or 10 years back. That is one thing we request them to do. Second thing what we do is, especially in general wards, we try to put patients who have got the same disease and are of the same, next to each other. And I think that is extremely important. One of the speakers mentioned that patients in tier 2, tier 3 cities just don't reach out to one another. I think in our practice, what we see is most of our patients are coming from small towns or from villages. And remarkably, they have a fantastic ability to connect to other patients. So if you put patients who are from the same social background, from the same financial background, and virtually more or less the same disease, we see that they tend to chat a lot. In fact, I have had patients who want to come on a similar day to along with the other patients so that they can meet every cycle of chemotherapy. So I think that way we can, even though we don't have a formal support group in many cancers, we try to give that emotional and social support which is required. Not only from the family, we need someone else from outside the family. So when the patient is undergoing chemotherapy and is comparing their say notes, what happened in the last cycle with the other patient who's also on very similar treatment, they tend to have a much more positive effect compared to just the doctors telling us. So I think people from the villages especially have a remarkable ability to connect to other patients.
Okay, that's great that they are able to connect with other patients during the course of the treatment. Preeti, if you're here with us, I still wanted to just speak with you and find out. Did you speak to other cancer patients anecdotally, if not actively? How do you feel about your entire journey of cancer treatment?
Yeah, hi. Basically, I hadn't spoken for so long, except last time when they had this Alpacilib program to come in India. That time there were 5-7 patients who were put on video calling together. that was one of the times when I could, reach out. But yeah, I feel if there is a chance that I can speak to other patients, it would be helpful because, people do tend to lose hope and tend to, not foresee what could happen and things like that. Definitely, I would want to be there to give hope to other patients also, right? So I do feel if there is some kind of platform where, people are getting in touch if they want to know something, it would be good to be of some use in that manner too.
Right.
And because having a positive outlook for everything is very difficult unless you have really heard from or you have really seen somebody going through the same thing. It becomes very important. I think it would help a lot.
Yes, because your family may be sympathetic, but they may not know exactly what you're going through. But in a support group, perhaps those people will relate what you're going through, and perhaps you get some tips, if not just support, on how to deal with it better. Preeti, what would you like to say to the audience here? We are trying to this entire initiative is aimed at increasing awareness about breast cancer in our country, being proactive, doing self-test, if they feel it's required, going for screening, because early diagnosis leads to better outcome. You were diagnosed at a later stage, but you're still here and you're talking to us. What is it that you want to tell everybody who's joining us here on what the journey is like and what one should keep in mind when undergoing this journey?
Well, I think I would really like to say that definitely, more than only the female society being aware of it, the male people also who are around in the family has to be supportive, right? So it has to be a kind of, you know, uh, awareness on both the fronts. Like not only female, but even the male people are supposed to know about things. Okay, it's important for ladies to undergo screening at this and this age. It's necessary for this. Or it's, definitely if you see this kind of change, maybe like if the wife is complaining of something of this sort, the husband would be at once taking it, okay, let's get it checked. So if these kind of things happen, I think it would be very easy for the girl to like talk about it and get it done. There won't be any hindrance then. So, yeah.
So you're saying we should talk about this socially. We should not have stigma or taboos attached to this, and this should be seen as any disease that needs to be treated proactively.
Absolutely, absolutely. It would be like, actually, normally I feel in India, it's, whenever a lady is passing through something, a woman is going through something, any kind of health problem, she wouldn't report about it to the family for maybe, quite a long time till she can pull it off. That's the main thing because of which, things go unnoticed or undiagnosed. If we have that habit, okay, the moment something is popping up or something is happening, we can see some difference maybe. If that's kind of said openly, things will not go on that back seat kind of thing.
Okay, and you're saying that not only should you, speak it out, even those around you should be able to tell and, perhaps nudge you to be more self-aware.
Absolutely, absolutely. In fact, after I went through this, I always like talk to the other women in my family. Like, I said, okay, if we are suffering, let's say about it. Like, let's be this thinking, okay, it should be informed at day one. Let it not go on till you are trying your level best to go on battling with it till the end, till you reach that stage where I cannot battle it any longer. So that should be the kind of awareness that should be.
So Preeti, for the women who are listening to you, some may be, battling this disease as we speak. What is the message that you have to give to them? What should they think about as they go through this, and how should they try to channel their emotion into positivity or something hopeful to look forward to?
Yeah, like what I said earlier, it's very important that whenever you have any disease, you at least think, okay, it's not a fatalistic disease because I have got this wonderful gift of life.
Yes.
So So the moment that comes into your mind, the way you're looking at the whole process becomes really easy. Yeah, I have it. No, let me just enjoy it till the moment I have. Okay, maybe there were certain things which I just put on, okay, kabhi karenge, we'll do it sometime. It's not necessary to do it right away. But once you are aware of having this, I think it just everything came on the forefront. Okay, just let me put the most important things in the forefront and let me just do that focusedly. So instead of doing 10 different things which were less important, you do the 3 most important things, which is going to give you pleasure in life. The moment your attitude comes into that, each day becomes much more happier, much more productive, right? So that outlook of having it in that manner really makes you feel much more worthwhile of having this thing, like of battling the situation also. And once in your positive frame of mind, I think everything just becomes wonders. You really start seeing wonders in your life. So the most important is the positive.
Did you feel, Preeti, that the care that you got and the treatment that you were receiving also somehow gave you that hope and the confidence that you will beat it? So you got it in a timely manner. Should that be the message to women listening here as well? That do it in time, because then you will feel more in control.
Absolutely, that is definitely this thing. But see, finally, it's like the fate, when you come to know. But after you've come to know, the most important thing, I think the doctors also, instead of scaring sometimes, I feel I was very lucky in case of my doctor. Like, even if I was like, I think every month I've gone and said, as yet also, I am not being all totally rid of my pains or things like that. Because you can imagine the spine was, affected. How deeply I was having problem even to stand or even to sit. I cannot sit on the floor or things like that even till today. And the pain is quite intolerable at times. Every month I go and think about these things. But you'll say, okay, we'll just manage this, right? It's all right. I think you can do it, right? And then you just kind of say, okay, yes, I think I can do it. I don't need to complain about it so much. And you again come into that positivity. Okay, this is a part of kind of thing which will pass through. The pain will pass through. That kind of a hope really makes it important. And the moment if I was told, see, like you have to just be prepared, you have to, like this could have been worse or things like that. If it would have taken, I think if it was taken in any other way that the doctor scared me even more, it would have been even much more difficult for me to this thing. With this light way of he putting it in front of you, you feel, oh, this is no big deal. I'm just dealing with some small thing in this. So that really helped me to be like that.
All right. So, Robert, Preeti was very lucky to have a very supportive family and doctors that were also very kind in their treatment and very supportive of a mental position as well. Now, in our country, mental health is something that is all very hush-hush, while it's not like that in the West. Do you think for breast cancer patients in India, this could be a problem? And do drug companies also help in any way to connect, patients with, need some support group help or, mental health experts? Or do you ever consider that part of the treatment as well?
Luckily for me, I did not need any mental health expert. As I
okay, great.
Yeah, but definitely at you are seeing patients who need it. Definitely, it has to be suggested by the doctors at that point of time, and it should be it should be definitely sought upon, because 100%, as we see in any treatment, mental health comes first. Only if I know I am going to be healed will I start healing. Will I see some real positive effects? So 100%. Very important. Yeah. So one is that. I think even with other patients, if they feel, by meeting similar patients, if that is going to help, definitely that kind of a forum has to be provided.
Right. So I was asking Robert this question because in our country, even mental health is something that is very hush hush. Plus, what I wanted to understand from Robert is that does he feel that uh, whether media influence also impacts the way patients feel? You have reports of somebody being so upset about their health, committing suicide. Does that help? Does that affect people on a general basis? Or, when you have media reports of your influencers coming on tops, fighting cancer, recovering, that also gives you hope. So, do you think our social influences also help with the way we feel? Plus, do drug companies also help connect patients with support groups?
So I think that mental health is a really important part of this. I mean, when we talk about cancer care, we're often just talking about the length of life, but what's just as important is the quality of life.
Quality of life, yes.
And I can speak the experience in my own family. My mother had colorectal cancer, and when she first understood the diagnosis, her first reaction was, this is my time. I'm not going to get treated, which is unbelievable. She's a well-educated lady. She's got a supportive family. And we, as her children, had to ask her, what are you doing? What are you thinking about this? And it's because of the mental health impact, and your self-esteem goes through such a low point. You can really take some decisions which are not in your own best interest. So that's when you need that support around you to help you through these very difficult moments. And in this case, she got over it. She had the therapy, even though it was quite advanced disease. She got through it, and 10 years later, she's still with us. She's got two more lovely grandchildren now. So it's had a happy ending. So I think patients need that support network to help them through those difficult times. Now, what's our role in pharmaceutical companies? Well, many companies, including Novartis, offer these programs for people who are on the medications to get access to different kinds of support to help them through that journey. So, but I think there's a role also for not just for the companies, but for the healthcare system, so the government funding to really roll that out so that more and more patients can access that, whether you're rich or poor. Like I said, some of these interventions are not expensive, and it's all about we heard from everyone else about there are people out there that want to help, and all we have to do is connect people.
Yes.
So I believe that there are cost-effective solutions out there to make some of this support available to everybody.
Right, and Dr. Prasad gave us that example where they purposely decided to put breast cancer patients of the same age and have similar backgrounds together when they came in for treatment. Dr. Prasad, I want to understand from you in India, there is also a belief coming around that the public health system will play a very large part in cancer management in our country, especially when it comes to late stage disease. When late stage patients are presenting themselves in government hospitals, they may not, you said the burden is high, and the doctor may not have enough time to even counsel you completely. You have your family to support you, not support you. In the public health system, what kind of care can be given to ensure that the quality of life of the patients, at least from the mental perspective, can be maintained to some extent? In private hospitals, we pay a lot of consultation charges, etc. So we may get, and we can pay for counseling, we can pay for mental health specialists to help us and things like that. for the larger population and the government hospitals, they're doing a great job. Many government hospitals give free chemotherapy, etc., cancer treatment. How much can they help to ensure that the patients remain happy during the course of treatment as well?
See, basically, I'm working in a private setup, but we do run the government schemes also. So most of our patients who have a BPL card get the treatment free of cost. So be it, for example, if you have taken breast cancer, the basic treatment like surgery, chemotherapy, radiotherapy, and hormonal therapy are covered by the government. The only high-end some of the patients, like for example, the targeted therapy like trastuzumab are not covered. So a basic treatment is available now for virtually all patients. I don't think at the present moment we can deny treatment for anybody. Regarding the mental aspect of it, in our hospital we do have counselors, and irrespective of what strata of society they come from, they counsel all the patients equally. So it doesn't matter whether you cannot pay for it or not. We do have quite a lot of paying patients who pay for their chemotherapy and take it. And these counselors, I think, just like doctors, work irrespective of whether they're going to pay for it or not. So most of our patients who are under the government scheme, getting free treatment because of the government, will get counseling done irrespective of whether they can pay for it or not.
Okay. Dr. Malhotra, one of the questions I asked Robert was also about what influences us socially. We want to do this awareness so that people start talking about it. And, one of our experts said that Angelina Jolie's, proactive mastectomy did more about the BRCA molecule than any information or scientific data that we may put out. So what do you think is the role that is played by our influencers or the society we live in, and about people who make it, and does that also play a positive part in the positive mental conditioning of breast cancer patients?
Yeah, I think it would, but one has to remember that, as somebody earlier mentioned, that we would be, we live in many centuries simultaneously. You have, people in the villages, the poor, those who are living below the poverty line, and others who have possibly, who can afford everything, who have access to modern gadgetry, who can, so I think we have to, but then there are certain icons who would be possibly common to all. And Angelina Jolie effect could also be felt even in India, but, in maybe about 10 to 20%, because though she's a big star and influencer, but for 80% of Indians, they wouldn't even know who Angelina Jolie is. So maybe we would need to have our own influencers, so that the vast majority of our women who live in the villages, who are below the poverty line, can be made much more aware of these things. I do have a very important role to play, but we must understand that a country which is living so many centuries simultaneously does need to have a multi-pronged strategy. Like our targeted therapies, I think we need to have an approach to even creating awareness in our society. It is unlike in Western societies, where a kind of one size fits all for awareness, even if not universally true, could hold true for a large section of society. I think we really need to have different languages, different icons, different influencers, different ways of dealing with it. For example, a 50-year-old lady in a village would possibly not be really on Instagram. So if it's an Instagram, or a Twitter initiated movement, maybe that would not reach her. So it would reach 20-30% of our population, which is significant. But I think, as I told you, that we need a multi-pronged approach, a targeted approach to even creating awareness.
Okay, we need a targeted approach to create awareness. Preeti, I'll again come to you, and we're going to start taking closing comments. And I want to come to you, for the last word on what you want to tell other patients. We've had other patients who tell us that, you got to make up your mind that I'm going to beat this. You got to believe in it, that you can do it. And it is natural for your family members to get scared. Initially you may feel a denial, but in the end, it is you who has to sail through it. So, what would you like to tell, other people who are watching? What has been your experience with breast cancer? What is a message you want to give?
Yeah. Basically, the last word would be, of course, cancer is a word, which scares all of us. But today, with the most, I think modern medicines and very good doctors and lovely treatments which are there in hand, definitely, I think we can beat it. That would be the only this thing. So, like, let's just be positive and we can do it. That would be the word.
All right. You need to believe that you can beat this, and there is the medical system working behind you. Thank you so much, Preeti, for joining us today and sharing with us your experience, your feelings, your emotions in your journey fighting breast cancer. Robert, I'll come to you. In conclusion, what would you like to say about what breast cancer patients go through mentally, as well as the course of the treatment? There's so much to deal with: pain, anxiety, wondering of what will become of their lives, how long they live. Uh, you know, what is it that you would like to say in conclusion?
Well, to be honest, I would actually rather hear from one of the doctors, because I think they have a lot more experience in communicating that. My experience is quite limited in that. So I would actually rather hand that final comment over to one of the physicians.
Sure. Dr. Malhotra, you said that we need to have, targeted communications as well, because awareness is very important. And I'm sure this is the first step. There'll be many more steps that we will take, and we hope that the government also devises its communication plan on a community basis so that a lot of people are in the know about this. But, there is a fear about cancer, and there's a fear about breast cancer. So when we do talk to people, we want to give them hope, and we don't want to make it something which is even more fearful. So, in conclusion, what do you think should be our communication so that it doesn't seem like a insurmountable battle to people?
So yes, I think we need to be careful how we communicate with the patient. We need to tell them that there is a cure whenever there is a cure, and in some instances where there isn't, we need to tell them about all the all the avenues of treatment that are available to them to lead a productive life with a reasonable quality. It's very important in breast cancer that we not only treat the disease, which we often are, we mistakenly only treat the disease. It's very important for us not only to treat the disease, but to treat the patient as a whole. We need to treat the family. We need to treat society as a whole by creating awareness of the disease itself. So I think it's something that we, need to do it on a very holistic scale: the disease, the patient, the family, and society.
All right. Dr. Prasad, what would you like to say in conclusion? Is it the mental health of breast cancer patients? Is that important? Does that impact the course of treatment? How important should it be to the team that treats the patient as well?
So I think mental health is extremely important. I think the most important thing which a patient probably requires is time. Time from a doctor. The doctor needs to give enough time to listen to the patient. Similarly, time from the relatives and family and friends. So you need someone not to do anything. You just need to sit with the patient and listen to them. I think if that time is given to the patient from the family and from the society, I think it'll go a long way in improving the mental health. And I think another important thing is for the relatives and for the society not to burden the patient with too many suggestions. You just see anything on WhatsApp, you want to share it with the patient. It actually is a huge burden for the patient and causes a lot of confusion. So give time, but not to talk, but to listen to the patient.
Right. And as doctors, do you then have to clarify all of this, the misinformation that the patients have been fed with, and don't eat this, don't do that? Do they come back to you for clarifications on this?
Absolutely. We get our head eaten with all those questions. So I think what happens is too many misinformation. See, these internet and the virtual media has got no control. So you can write whatever crap you want. So I think it's very, very important. Even when we counsel patients, we do suggest them some websites which are standard from the government, from big institutes, where clarity is given to the patients. Patients don't want to get confused. So I think from the relatives point of view, we need to just give time to the patient, listen to the patient, do not force your views.
All right, do not force your views, and make sure that wherever you get the information is trustworthy, and most of all, trust your doctor. He's there for you, and he will give you the best possible course of treatment, and will give you your time to understand your condition as well. I'd like to thank all of you for joining us today to talk about this very important aspect of treatment of breast cancer patients and their treatment journey, which is their mental health. Thank you, Dr. Malhotra, Dr. Prasad, Robert, Preeti. Thank you all for joining us, and I'd like to thank Ms. Bhakti Kodar as well. She had another appointment she had to leave, but thank you all for joining us today and talking about the mental well-being of breast cancer patients.
Thank you for having us here.
Thank
you very much.
so much, sir. Thank you all.
Thank you.